Hey, what's up, guys? I know it's been, I didn't do a week 2 or week 3 post-op video. I'm sorry about that. I've been just really busy, focusing on my recovery. I've been going back to work, things like that. So it's been kind of hard, making sure I'm getting the rest I need, fitting in my PT exercises, going to work, and things like that. So I kind of fell off on doing my post-op videos. I'm sorry about that, but I'm back now. I'm going on week 4 now, so I'm just gonna cover week 2, 3, and 4 all in this one video. I'll start right where I left off on week 1. Starting going into week 2, it was pretty much the same thing as week 1. I wasn't really moving too much. I was still in a lot of pain, so I kind of just like didn't really move as much. I went back to work though a little bit, and then going into my week 2, I saw my ortho again for the week 2 post-op. He told me everything was going really well. They took my bandage off then. Obviously, it's week 4. I'm going on week 4 now, so it's a lot more healed than it was then on week 2. I'll show you guys right now though, but it's pretty much healed for the most part. A little scarring, which is, that's expected. Although it went really well though, he told me no flexion still, not until at least I see him on July 8th, which would be my week 6 off. No, yeah, my week 6 post op on July 8th. That's when we'll probably start working on flexion. He still told me I can work on weight bearing though. I'm still gonna be able to walk, thank God. He gave me like just full access just to start putting all my weight on it after I saw him on week 2. So, I'm still not walking though. I'm not gonna lie. Mostly because I've been I'm not trying to rush it. I really don't want to risk a re-injury or anything like that. I don't want to force it. I just want to let it happen naturally. It'll happen eventually. So I've really just been, putting weight on it a little bit, walking with the crutches, standing. That's pretty much it. Focusing on massaging the kneecap. I have a lot of, the doctor says I have a lot of scar tissue. So I really have to work on massaging the kneecap and moving it around to break some of that scar tissue, because that's what's really going to hold me back from when it comes to bending the knee again. I started PT. PT went pretty well. I like my physical therapist. She's really cool. As you can imagine though, when it's your first week, especially coming off an injury like this, you're not going to do a whole lot. Just a couple basic exercises. Well, basic, probably for like a normal person, but it was actually a little challenging for me, I'm not gonna lie. I just had surgery, so it's basic stuff. I'll show you right here, like quad sets, abductions, hip abduction, a little pillow between, squeeze the pillow to work my hips, glute sets, hamstring stretches, and calf stretches. I basically did that for a whole week after I saw my PT for the first time. It was pretty difficult. Like as far as like the quad sets, I could do like the outside of my quad, like on the side, but like the remedial part, like in towards my inner thigh, it was dead. Like I couldn't flex it. It would just like, it couldn't do anything. But the other side could. So obviously, I had to work on that. Now I can do a quad set, no problem. I'm good now. Pain, of course, is going down as time goes by. My leg, I feel like it's getting a lot of strength back. I'm able to move it more. So things are definitely getting better. It takes time. Just got to remember, that's all it does. It just got to be patient. It takes time, especially that first week too, because that's just, naturally just waiting it out. You're waiting for the pain to go away. You're waiting for the swelling to go down. You're waiting for the fluid from the surgery to go away. You're just, you're really just letting your body do its thing at that point. So I just saw my PT today this morning. She gave me a couple new exercises. I'm doing a little more challenging stuff. I'm doing leg raises now, which are a little difficult, but the quad sets were difficult at first too. So leg raises, side leg raises, and she gave me another stretch to do with my leg up in the air and things like that. I guess I'll show you the picture right here. It's pretty much what it looks like. Kind of stretch my hip flexor. So yeah, that's it for the most part. I'm doing well. I mean, it's just like I said, it just takes time, um, and I'm just doing everything I can to to make it better. I mean, diet wise, I've changed the way I've ate completely. I mean, I drink nothing but water, absolutely nothing but water. I eat nothing but lean protein, steak, chicken, fish like salmon, tuna. Um, I eat a lot of eggs, a lot of whole grains, whole wheat bread, brown rice, whole wheat crackers, a lot of vegetables, a lot of fruits, avocado, spinach, asparagus, pineapples, strawberries, oranges. I mean, bananas, like a bunch of stuff. I switched to almond milk. I'm taking collagen supplements. I've really changed the way I take care of myself to help, speed this recovery as much as possible. Because I really just want to get better, as fast as I can. And if changing the way I eat will help, then no problem. I mean, it's, what I mean? And honestly, I felt better since I started eating differently. I mean, I'm not gonna lie, like, just, I feel better physically. I don't, I remember like eating, like, I used to, oh my God. I mean, I'd never really been on a diet before. I mean, I've tried in the past and it wouldn't last. But like, this is the longest I've ever gone, and I've been really strict with it. And I'm not gonna lie, like, I felt really good. I'm staying away from fried foods. I'm staying away from sugar. I'm staying away from like anything that's just not gonna help my knee get any better. I'm staying away from it. I mean, that's anything. I mean, I'm staying away from, like, if it's not benefiting my recovery, it's gone. Bye. And that's just the way that's the way you have to look at it when you're going through something like this. Like, you really just have to put your full focus towards this, because this is the only thing that matters right now, is fixing your, focusing your recovery and fixing your knee. That's all that matters. And that's what you have to put your full focus towards. So yeah, week 6, July 8th, that'll be my 6-week op. I'll see my ortho again, and he'll probably unlock my brace a little bit so I can work on doing some flexion. So far though, it's I'm going on week 4, still on crutches, but putting weight on it, able to stand, not too much pain with that or anything. Doing PT, working on leg raises, side leg raises, things like that. I've been doing my PT every day. You gotta do your PT every day. If it's twice a day, you gotta do it every day. Whatever they tell you, you gotta do it. Like I said, I changed my diet, and yeah, so I'm doing pretty good. Anybody who's watching this, I mean, just keep your head up. I mean, it's gonna be it's difficult, especially at first, like I said, but it just, with time, it gets better. You really just gotta be patient, keep your head up, and just stay focused and stay, motivated and determined to get better. Just, that's all you got to do, is just keep in mind that you want to get better, and just stay focused, and don't let anything distract you. Don't let nothing else matters. Nothing else should matter to you right now besides getting better. Your full focus is just towards your knee. That's the best advice I have right now. Also, don't rush things. I've been watching a lot of videos like this where people posted about their recoveries, and I saw one guy, I forgot the name of his channel. Cool guy though. I watched a lot of his videos, but he gave a really good, like, he pointed out something that's, like, really important. I feel like everybody should know going through this injury is, everybody's injury is different. And I know a lot of people say this in all the videos, but everybody's injury is different. Not everyone's gonna have the same recovery, and not everyone's gonna recover as fast. So keep that in mind when you're working towards getting better. And that's why I don't want to, push walking too. I don't want to push too early. If I'm not ready, I'm not ready, and that's just what it is. That's my body, and that's my type of, the tear I had. It could be different from his. It's gonna take me a little longer. It is what it is. But you really have to keep in mind that everyone's injury is different. Everyone's recovery is different. Everyone's doing different things differently. Like, I've seen people walk at week 3. I saw a guy, his channel's called Max Fit. Great dude. His recovery went really well. He was walking at like week 3 with like no crutches at all, but he actually started physical therapy like, I think, week 1. Like, he started it really early. So of course, it makes sense. He started PT really early. His recovery is going to move a little faster because he's, so just keep that in mind. Everyone's recovery is different. But just, stay focused, work with your knee, take care of it, and I'm guarantee you things will get better with time. Just got to be patient. So yep, I'll try to do a week 5. If I don't do a week 5, then I'll definitely do a week 5 and 6 video to keep you guys updated. Like I said, I might put those pictures of my knee when I took off the bandage somewhere at the end of this video. But yeah, that's gonna be pretty much it for this video. As far as PT, I kind of wanted to record and show myself doing those PT exercises at physical therapy, but out of respect for them, they don't like everybody having their phones out in when you're doing your exercises. So out of respect for them, I was just like, okay, it's fine, it's whatever. But yeah, I'll see you guys again once I do my week 5 and week 6, and we'll see where I'm at then.